Sickle cell anemia is an inherited blood disorder that causes sickle-shaped red blood cells that can stick together, blocking blood flow and oxygen from reaching all parts of the body.
As warriors, we were told that you want to get to an age of 5 years. When you get to 5, they tell you maybe you want to make it to 10.
In Kenya, thousands of children born with sickle cell are misdiagnosed and end up being treated for other diseases.
TB and malaria, of course, because sickle cell symptoms zinafanana kaza malaria. So because there was not too much awareness, even my mom didn't know what the truth was and the lie was. She just accepted the fact that it was TB. And I was diagnosed with TB, nikaanza kuchukua madawa za TB. I was told by my mom for 6 months I was just taking TB medicines.
And for those who get proper diagnosis, lack of awareness in many areas is a major setback to proper treatment.
When you are young is when the crises are more, and then you can't communicate and say exactly how you're feeling.
And because children with the sickle cell disease are at an increased risk of infection and other health problems, early diagnosis and treatment are important. Therefore, it is important to watch out for signs of the disease during the first year of life, usually around 5 months of age, although symptoms and complications are different from each person and can range from mild to severe.
You get very painful at the joints. Sometimes you cannot even walk, and then it can come with the chest pains.
Management of sickle cell disease is focused on preventing and treating pain episodes. They can be triggered randomly and differently from one person to another.
If you are stressed out, if you get maybe an attack, it can affect your respiratory system. It also affects the spleen.
Drinking plenty of water, regulation of body temperatures, avoiding places or situations that cause exposure to high altitudes are some of the prevention strategies in treating sickle cell.
To manage such attacks, you need maybe a hot water bag, and then you can massage the areas that is painful or has an attack.
And in order to be ahead of the disease, sickle cell can be diagnosed with a simple blood test while the baby is in the womb. Diagnostic tests before the baby is born, such as chorionic villus sampling and amniocentesis, which checks for chromosomal or genetic abnormalities in the baby. This will then prepare the parents to start treatment for the disease early and give the child a normal life.
If awareness could be created and sickle cell be at least almost every hospital, because right now it has really spread in so many areas and there are so many warriors, and it is just like any other disease. So we need the awareness out there.
Robbie Omondi, K24 Health Beat.